Great texts of homeopathy that we all know. Kent's Materia Medica, Margaret Tyler's Materia Medica, Burica. And these are big books in India, I know that. There's very little about, there's nothing about carcinogen in these books. You know, these early books. Absolutely nothing. It's not even there as a homeopathic picture, except in one of them. And that one is Clarke's Dictionary of Materia Medica, another book which I know is printed in India. I mean, probably you can only get it in an Indian edition, which is India a major contribution to the survival of homeopathy, or Indian publishers keeping these books alive. This book has exactly how many lines? I'll just tell you now. Something like 16 lines on carcinogen. That's all it has. Clarke's Dictionary of Materia Medica, three-volume compendium, which has many pages on the famous remedies. But in this book, a Dictionary of Practical Materia Medica, it has exactly how many? It's 12 lines on the indications for its use, and it's almost an appendix to the main work. So it is minor. And yet, Clarke says something amazingly important. He states there, even though he doesn't give indications in a complete drug picture for this remedy, carcinogen, Clarke states that he used it, this is quote unquote, he used it more frequently than any other diathesic remedy. That means diathesis would mean what we call constitutional. He's saying I use this one constitutionally more than any remedy, but not saying how or what indication. So that's already extremely mysterious. In 1954, it was thought the remedy was called in those days carcinosinum. So as a nosode and given this more Latin sound at the end. And although the original source of this remedy is not uncertain, it was thought to have been prepared from a breast epithelioma. Okay, already that's even unusual as well, because a much more common cancer of the breast, as we know, is a carcinoma. In 1954, Dr. Templeton proved this remedy, but it was a minor proving, and that actually, when they look at this proving that was done, is nothing like the picture of carcinogen that we know today. Nothing like it, okay? Then something happened. A man called Donald Fubister, who was head of Pediatrics at the Royal London Homeopathic Hospital. Now this requires a little explanation. That when Dr. Amit, came to London and studied in the homeopathic hospital, it was a very different hospital. It was shared by other disciplines, etc. But that basement, where we had our lectures and everything, we had a tutorial room there in the basement, and it was carpeted and all sorts of things. But when I was there in 1982, 83, it was very different. It had green tiles there that had been in the 19th century, and all the rooms there were outpatient rooms, and there were different departments, less so than in the 60s, okay? Less so than in the 60s and 70s, where they had different departments, a dermatology department, there was certainly a pediatrics department. And in that, and I can picture exactly where it is, no more than 50 meters away from our tutorial room, Amit, was the rooms where the doctors were seeing patients, and Fubister was one of them. And what he noticed something. He noticed a similar appearance in two children, both suffering from insomnia. That's what he noticed. Both had been born of mothers who during their pregnancy were suffering from carcinoma of the breast. And he noticed that they had the typical cafe au lait complexion, the blue sclerotics, and many moles. So these were the original guiding symptoms to prescribe carcinogen. Cafe au lait complexion, which you're going to see less in your continent. Blue sclerotics, I'm sure you do see that, and moles, I'm sure you see. Okay, so for so many years, what Fubister did is that when he saw children with a history of cancer and observed a few of these characteristics, he gave carcinogen. Okay, so what he's doing now what this means is that he's giving a homeopathic remedy on a very small amount of information, mainly family history. Okay, and this is what he did. But now what he begins to see as he does this is by giving a lot of remedy, a lot of children. In fact, I did speak to someone, this you will not read in any book, but the person who co-wrote studies in homeopathic remedies, Dr. Marian Harling, she reckons he just about gave carcinosin to anyone with the slightest history of cancer in the family. And then what he did was he observed which cases did well and what was common to all those cases that did well. Now what your keen homeopathic students will immediately see here is this is not the homeopathic method. The homeopathic method is to do a proving and then to treat according to the provings. This is what you're doing is to accumulate what we call clinical symptoms. A clinical symptom, for example, is that pulsatilla is very tearful. It doesn't necessarily that pulsatilla will make people tearful. Even more clinical will be that pulsatilla, often as Kent describes in Chicago, blonde-haired with pale skin, etc. These other characteristics have got nothing to do with homeopathic provings, but they are nevertheless reliable indicators simply by repetition that when you give this remedy to someone who has this, it seems to work. But the whole of carcinosin, the picture that we have built up now, came from Phubester starting to observe, and this is very, very important what I'm saying now, starting to observe what the patients who responded to carcinosin had in common with other patients who had responded to carcinosin. It's never received a fantastic proving. And this picture evolved over 2 papers that are still very famous homeopathic papers that were published between 1954 and 1958. And they then also included symptoms observed in adults. So what happens is, basically what Phubester said is the family history of the person is important, background of cancer, tuberculosis, pernicious anemia, diabetes, or any indication, history of glandular fever, whooping cough, here comes the first thing, any exanthan, a childhood illness that occurs twice, 2 cases of measles, 2 times this, or pneumonia at an early age, he says, also an indication. He even said a severe reaction to vaccination is an indication. All these are observed. All these are clinical symptoms. None of these come out of provings, okay? And so then, slowly, he develops a picture, okay? The bluish clearer, cafe au lait complexion, pigmented moles, blinking eyes, bizarre tics, and then he starts to observe something else. He starts to observe strong symptoms which belong to other remedies occurring in a sort of unpredictable mix in carcinosin. For example, he observed that the subject may be fastidiously tidy, like Arsenicum album nux vomica, Anacardium or Graphites, or the opposite sulfur, untidy. He may enjoy storms or hate storms, be sensitive to music, hates music, but generally sympathetic to others. Children are sensitive to reprimand, like Medorrhinum, and sometimes aggravated by consolation. Insomnia is common, and we develop the picture like this. So let's think of the picture, and I'm nearly finished speaking now, and we will hear what the other moderators say, and we will discuss more, of course, but there can be strong cravings, there can be all sorts of symptoms which are well-known symptoms in other remedies. And so it goes, okay? And there are many other physical symptoms that we can see. So finally, I'm going to reflect on what I think is the essence of this remedy. And whether one wants to believe in essences or a deeper understanding of the remedy or some concept that pulls our understanding of the remedy together, that's up to you, whether we do it. When we say, for example, George Vitulcus and others think it's sepia, the essence of it is stasis. Everything is still, the water isn't flowing, things aren't moving, and therefore the sepia patient feels better for exercise because when she or he moves a lot, things flow a bit better, or when there's lightning and dramatic weather, it wakes them up, it stops the stasis. So this is a sort of way of looking at homeopathic remedies, to find a single theme. Massimo Mangialavori would be keen on looking at these themes. To me, if you look at what has emerged in the carcinosin picture, when you see things such as a childhood illness occurring twice, like funny little moles appearing a lot in the body, strong reactions to vaccinations, when you see all sorts of things happening in a haphazard way, and in particular, I find it very interesting that this remedy has lots of other strong symptoms that are strong keynotes in other remedies. It seemed to be this mix. And one day it occurred to me that the key word for carcinosin for me is a lack of differentiation. It's hard to find the exact carcinosin picture itself. It is a mixture of other things. And when you think about it, isn't that the way that, isn't lack of differentiation, non-differentiation or undifferentiated tissue, isn't that the very essence of what cancer is? So this undifferentiated tissue starts taking over. It is disorganized cells, disorganized tissue. And therefore it's not surprising that this is reflected in the apparent disorganization of the symptoms that we use to prescribe carcinosin. And with that reflection, I would very much like to pass on the microphone to my fellow moderators, and then I think we should invite other people to ask questions and give their views.
Thanks, Brian. That was an excellent short snapshot on carcinosin. What I'd like to know from you is that, traditionally when we talk about carcinosin in terms of prescribing it, we say that we'd like to prescribe it as away from cancer as is possible. However, you will see authorities like Clark say that it can be given when the symptoms, the disease itself exists, or it receives a mention in Boric for cancer of the breast, of the uterus, and so on, and even for cancer cachexia. So what's your view on this?
Yeah, good question. What I've noticed, I haven't heard many people that think, all right, we'll use carcinosin, this actual remedy, carcinosin, in cancer. You might have heard it in India a bit. I have heard what Indian homeopaths have written about treating cancer and stuff like this. Obviously, it's a complicated field, and we shouldn't say that we can treat everything with it. We don't need any of conventional treatments. But I think the remedy that I see a lot coming up in the treatment of cancer is related to carcinosin, but not carcinosin, scirinum. I think I have heard a lot of homeopaths say they use that one. I don't treat cancer patients really, but I think that's the one that I've heard, scirinum, which I think is in the same family as carcinosin. But yeah, just to give carcinosin for cancer seems pretty primitive to me. No, I haven't used it that way, but I have had some great results with Never-Welson's glandular fever, and the picture is, I'll tell you what my own experience of the picture is. It's not a lack of symptoms that you give carcinosin. It's if you've got so many strong symptoms and they're not adding up and they seem to have wanted this remedy and that remedy, and one day you think, wow, it's carcinosin that pulls this picture together. But yeah, I wouldn't have thought it sounds that sophisticated just to give carcinosin for cancer.
Thanks, Brian. Sachin, any comments, questions?
I was fascinated by the story that you told us about how Dr. Faubista would give carcinosin to everybody when he started off and he wrote those notes down. Going forward, do you think that is a wise thing to do, or you think that was just experimentation? I mean, you've probably read a lot more about him and you know a lot more about Dr. Faubista. Could you throw some light on that, Brian?
Sure, yeah, I met Faubista. I met him, the man. Old man when I met him, but he didn't say he did this. Someone else that knew him told me that that's what she thought he did. I think he saw something happen. He saw a couple of cases do brilliantly, and he thought, well, maybe I should try this on everyone that has a parents with a history of cancer and see what happened to them. And I think he was surprised that so many of them actually got well. And then he decided, okay, now I'm going to hone in on those ones that did well and really look at all those cases and see what they've got in common with each other. It's not something we would do with homeopathy today, particularly, but that's what he did. So the word experimentation, I think, does does qualify, but I think in the most benign imaginable way. He wanted to get results, and he did see some results, and he thought, well, which of these children are the ones that I can then understand? These are the ones that really do respond, and therefore it will teach me about the picture. So you could call this a synthetic way of finding a picture of a homeopathic remedy, because the traditional classical way is simply to do a proving and what appears in the provings. But I believe these people that are fanatical about provings, they're walking away from the whole American experience of Kent and Herring and these people, that so much of what they wrote were based on their clinical experience of how they saw people respond to these remedies. This idea of just making homeopathy into an incredibly strict process of only the provings, I think, is limiting, because I think the provings only give us the skeletal structure of the remedy. Only with years, hundreds of years of using the remedies do we then understand. For example, strychnine. Okay, you take strychnine, it's deadly poison, and it causes your face to go into a rictus, and it's a hell of a terrible thing. It's not a big homeopathic remedy. Why? They've tried it, and it doesn't seem to be a massive homeopathic picture. But in the proving, you imagine what you would see. So I do think the clinical experience is really important. But it's a hot topic in homeopathy, the idea of the clinical symptom, a symptom that didn't appear in the provings, but is apparently reliable. One of the biggest ones is that to say that cal-carb is often overweight and all this sort of stuff. But this is very much a clinical proving and observation. I don't believe if you gave a thin person cal-carb 200 every day that they would become a very overweight person. I don't believe that. So therefore that is an observation. That's a clinical observation. So yes, I think I think it was experimental, if you want the short answer.
Thanks, Brian. I would like to just share with all my speakers that there is a wonderful, wonderful book compiled by Dr. Donald Faubister. It's called Tutorials on Homeopathy. The original publisher is Beaconsfield from England, and it's a book worth investing in. When you read this book, you realize how fluid Dr. Faubister was. In fact, if I could quote a small para that he says in his first few pages, to relieve pain from major operations such as an appendectomy, a combined remedy is often effective. He's one of the few bold homeopaths who is honest enough to write what he does. Staphylococcus aureus often covers pain in a cut wound. Bellis perennis covers injury to soft tissue. A combined dose of the 200C given before operation and repeated, say, 3 times daily post-operatively. This kind of honesty from a homeopath, and he has put so many of these small tips. I would call them tips. I use the word tips because homeopaths in India are fond of such things. This book is full of them. He will mention the use of petroleum and cocculus for motion sickness, and I think it's a book worth reading. Brian, you've been through the book. He has put down so many of his honest views on diphtheria, on prophylaxis, etc.
Yes, thank you, Sachin. And of course, the book Studies of Homeopathic Remedies, I edited those. You see, what Faubister did between, I think, about 1950 and 1953 and 60. When was it? Hang on, I've got it here. 1936 he studied homeopathy. Between something like 1946 and 1972 he wrote on 2 homeopathic remedies for every journal of the homeopathic hospital for all those years, 2 or 3, and in groups like belladonna, hyoscyamus and stramonium and stuff like that, these were all appeared in the homeopathic journal. So Beaconsfield commissioned us to edit this book called Studies of Homeopathic Remedies. But that's by Douglas Gibson, Studies of Homeopathic Remedies, and this is where we found this Faubister. We had to add Faubister's article to that book, so that description of the carcinosis and what I said to you is in there. But yes, Donald Faubister was the great tipster. You want a tip right now that Donald Faubister used that encompasses a combination? Would you like that, guys? Yeah, okay. One of the tips was, he said sinusitis is really hard to treat, sinusitis. You look for a constitutional remedy, and he would give a combination that I've used for many, many years, and it's Cala bichromicum 6X combined with Hydrastis 3X and Pulsatilla 3X. Low potency combination, Pulsatilla 3X, Hydrastis 3X, and Cala carbonicum 6X. And that he was full of tips like that. So yes, Sachin, you're quite right. Often when we use these tips, they were very effective, but not always. He would say Carcinogen is a sort of near certain excellent prescriber for a certain prescription for Never-Welson's glandular fever, but I haven't found that. But it's still often a useful remedy. And a person who says, I had glandular fever and I haven't been well since. But never near specific is what he said. I'm not sure it's that. But yeah, lots and lots of tips of Donald Phobisty. He was a gifted man. He was a bit of a healer. He could do a few manipulations, back problems. He had some eccentric views. He thought that people having long hot baths was really bad for your back. But he was an absolute character, a real larger-than-life human being. I only had one tutorial with him. He was an old man there. And the group, such as Amit knows that he was part of the group studying in London, we all went out there and we sat in the middle of winter around this fire and listened to this sort of very, very respected veteran of homeopathy talk about his experience in the field. He was, for many years, the most famous British homeopath in Europe, easy, and particularly because of this contribution of Carcinogen. So, Sachin and Amit, would you like, I think it's time for you to invite other people to put up their hands and give their opinion and come and ask questions. What do you think?
Yeah, sure. So, guys, any questions, please just click on the raise hand button and I'll bring you on to stage. Meanwhile, while we wait for questions, Brian,
sure.
This topic about clinical symptoms and its value and the argument between clinical symptoms and provings, I think this is what led to a huge difference in opinion between British and American homeopaths. Was it 150 years ago or
oh yeah, you want to hear about this? I can talk about this, but I will talk about this. And while I'm talking about this, I will say to the audience, please do not be shy to come and give your opinion, even if it's a quick question or a quick tip or something that you found out about Carcinogen. This is very much a sharing process. This should not be seen as a lecture of these three people with a green badge of honor that elevates us above you and then a line, etc. Please, it should not be that. The whole point of this is a discussion, okay? Amit, it wasn't only it was worse than a split between America and England. What it was, the key moment in this split was when two books were published. And the first one was Hughes' Cyclopedia of Drug Pathogenesis. Was a 4-volume incredible book because he basically, it's the Materia Medica pura that's been cleaned up a bit. And what I mean by cleaned up is that Hughes noticed that sometimes Hahnemann only had a handful of provers. He sometimes noticed that there was a symptom that just the one prover just came up with this digestive problem no matter what he was proving. It was ridiculous to include it because it was obviously part of his constitution, not part of the proving. That sort of thing. He cleaned it up. And the people said, in the homeopathic world, said that this book, this 4-volume book, which is a mammoth opus magnum, a massive work, would be lead homeopathy for the next 100 years. Nothing could have been further from the truth because soon after that, another book came along, which was much less scientific. It was much more based on clinical symptoms, observations in the clinic, the personal opinion of the writer about the different remedies. And that book, of course, was Kent's Lectures on Materia Medica. And that book is a massive book and influenced generations and generations and generations of homeopaths, and hardly anyone reads Hughes' Drug Pathogenesis. So what happened in England is, yes, we had this fantastic advantage here because there'd been Frederick Foster Hervey Quinn, the aristocrat who'd went and studied and learned about homeopathy in Germany, came back and built hospitals here. So we had hospitals and we had a professor of homeopathy, and Richard Hughes was, when Kent came out, it influenced British homeopaths, and several of them made the journey by sea to Chicago to study under Kent, and they came back as sort of full-on disciples of Kent. And there were complications about this, because with Kent came Swedenborgianism and a certain type of spirituality. And I think that that appealed in India as well, because connected to yogics and mystics and things like that did appeal. And also it was based on clinical symptoms, which was really important. So, hi, yeah, that's fine. So that is Sachin. I think that's the same name, but spelled differently, Sachin. Yeah, okay. So this is what happened. But what happened was, it wasn't just a split between England and America. It was a split, the American system split the English homeopathy right down the middle, between the Kentians, the new Kentians that were so inspired by Kent, and the other ones that said, no, that shouldn't be like that. We need to stick to Hahnemannian principles. And this was more than just a split in homeopathy. It was almost a deep philosophical split. And the reason it was a philosophical split is they were very different type of doctors. The doctors in England were highly classically trained. They would have learned Latin, Greek, and gone to sophisticated universities, whereas the doctors in America were different. They came out of a tradition of folk medicine and very much more practical and less academic, and very, very different type of medical doctors. So that is how it caused a split in British homeopathy that has persisted even to the present day, and we do see a sort of fluctuation in British homeopathy. Sometimes we go deeply into Kentian. When we formed the homeopathic group to teach in Oxford, we went much more to Kentian, Vitulka's constitutional type homeopathic remedy than the faculty. Now, not many years later, there's a slight movement back to more scientific studies, etc. Okay, so that's absolutely fascinating, that split in homeopathy between over-spirit. Some people said you over-spiritual, and others would say you you are over-practical, you are over-scientific, as it were. But we have another Sachin on the stage. Welcome, Sachin. Please share with us anything you have to say or questions you would like to ask any of the moderators.
Good evening, Brian sir. I just wanted to ask you about what is the mentality of carcinogen child? What have you observed? That, like, we have learned that they develop their mentality out of a dominating parent. What is your experience about this?
Well, thank you. If I'm absolutely honest, I have more given that remedy based on those Fubister symptoms. When I see the bluish sclera and maybe a little bit of hair going down the spine, a lot of anxiety, a history of any of these other ones, like reactions to vaccinations or twice a childhood illness. The only thing I could tell you is a certain type of anxiety that's not dissimilar from Arsenicum album, not dissimilar from that also, although you're going to hear more of Laura Cerasis, which is also an anxiety remedy, but that sort of anxiety, quite sweet, intelligent, thin. That's about as much as I'll say, but I would own up to using more the physical characteristics and the family history in much the way that Fubister did.
Also, sir, I have read somewhere, I think mostly it is in Bodic or it is in Kent, that I think both said that you will need carcinogen during the treatment of any cancer whatsoever. You must give carcinogen to complete the process.
I can't comment on that. I'm interested. Yeah, I did. As I say, there was a homeopath. I can't remember his name. Was it Ramakrishnan or something? I don't know. He came to lecture to us in Oxford, and he had this book that he'd written on treating cancer. But he had, as I say, Skirinum was the one that seemed to come up a lot, always being written. And now I'm looking at this book. Actually, I'd like to ask the audience myself a question that would help me, and it might be the right time to ask it now. There's this book called the Banerjee Protocols, where there are these protocols for treating different conditions. And I don't know if anyone on stage or in the audience can help me in how reliable this is. But I noticed Skirinum comes up in that one a lot as well.
So the Banerjee Protocols, they're devised by the Banerjee family. They have a combination treatment. They don't follow. In fact, if you read their preface, they have a disclaimer saying that they don't follow anything that Hahnemann wrote. They just use the medicines as a therapeutic indication. So they have protocols for every condition.
Yes, I did see that, and that's why although I'm a classical homeopath, I'm still interested if someone is treating a lot of people and they're saying, well, this remedy seems to work. This is what we'd call the search for specifics in homeopathy. See, even if you give a combination as Banerjee does, you give this one plus this, the three of them together mean a combination. It's a specific, you see, it becomes a specific. But we do have some specifics in homeopathy. The classic is belladonna for what you call it, fever, which...
Scarlet fever.
Scarlet fever, sorry, comes to my tongue, scarlet fever. And the one that I've seen in my life, and this is just shocking to me, that why Magnetus polaris australis can fix a ingrown toner. But I've seen it so many times that I can't doubt it. I don't know how. How does the potency of the north-south pole of a magnet fix ingrown toner? But I have seen it. So to me, that's, once you start seeing it 3 or 4 times, you tell me you won't give it the next time you see an ingrown toner. You're going to give it. So there is something to be learned in the people that are searching for specifics. As long as they're to be trusted, that's important. They need to be trusted.
Yeah, so there are a lot of doctors who are following the protocols here, and everybody claims some amount of success. But I guess the proof lies in eating the pudding, which most of us on this group haven't done so far.
Yeah, 100%. I agree with you, Sachin. It's like, if I use the Banerjee, if I look there, it's only when I ever look there after I've really tried hard classically, and then I can't find the classical remedy, nothing's happening. Then I think, well, what does this guy Banerjee say based on statistics of using these remedies? That's how I use it. But the wrong way, why I would agree that these doctors who use it just don't know homeopathy and haven't studied the remedies and are just using these protocols. This is insane. This is just following ABC medicine without understanding what you're doing. When I look at the Banerjee protocols, I can see why he's using lacuses and endometriosis or whatever he's included there. I can understand it at least. But the danger is that what happens if someone walks in as a perfect nitric acid? The person who's a pure Banerjee prescriber will not see the nitric acid, will not see the total picture conforms to a homeopathic remedy, and will just give the protocols. And that's why I do think that it's a lazy way of practicing homeopathy, just to give those protocols without studying the remedies themselves. And it's crazy in a way not to understand the different components of the remedies and the principles of homeopathy and just give it because you heard that it works. That doesn't sound like intelligent medicine to me.
Amit?
Yeah, Sachin.
I don't see any questions for this further. I think, Brian, do you think it's okay if we shift to Loroceraceus now? And
Absolutely. I just want to try to encourage the people to ask questions, because I think people are new to this.
Yes.
And I don't believe that people don't have questions. I think they're a bit shy to press the button to come up and get some of the experience.
Right.
No, I think, guys, why don't you come and share your experiences with carcinosin maybe? I mean, maybe you used it in cancer, or you didn't, or you used it in some other case that would be of use to everybody here. If and when you remember of a case, please do share with us.
Absolutely, yeah. We encourage people to come out. We must make a distinction between even I felt a bit asked before this session. I spoke to Dr. Amit and asked him how long should I speak, because normally, a couple of minutes is enough on Clubhouse. It's not a webinar where you are an audience that don't interact. The whole point of that we could do with a webinar, which we can do. Clubhouse is a brilliant place to organize webinars. But when we're on the actual app, this is much more about communication, about you people coming on, sharing your experiences, asking questions, disagreements, and thrashing things out in a really, productive manner where all voices are respected. And I suspect, we're dealing with people here that do have experience but are learning more about what it is to be on this app. So I think it's fine to move on, Sachin, and talk about Loroceraceus, and people can still come up and talk about anything they want when you finish speaking. So I'm passing the microphone to you, Sachin.
Thank you, Brian. Good evening, friends. One of the reasons why we have chosen laurocerasis is because with this COVID situation, this remedy I have used and a lot of homeopaths have been using either in the moderate stage or the severe stage of COVID and for post-COVID recovery. It's a small remedy, not much is really known about it. It's a small little paragraph. There are very, very few keynotes. But I think remedies remain small till you use them. So for me as a homeopath, and I think most of you who are in practice and active practice will agree, it's only after we use a remedy and we see the beautiful indication work that we start realizing the importance of the so-called small remedy. That said, I put a strong statement forward that nothing can beat the well-proven polycrests. Okay, so homeopathy is always this fluid. But being our mission to spread the light of homeopathy, like I like to use that word, knowledge of homeopathy, I think laurocerasis I chose because I want Amit to also guide us through a lot of simple things from clinical medicine, and he's going to talk a little bit about dyspnea and its differential diagnosis in our clinical practices. And he's the right person to do that. So coming back to laurocerasis, it comes from the common cherry laurel. And we must know a little bit about the source. I'm a little finicky that we must know from where our remedies come. This is a plant kingdom, and the tinctures of the young leaves are used to make. And in fact, it's the water solution from the tinctures that is used. Laurocerasis should not be confused with the bay laurocerasis, which is a different remedy. Okay. One important thing is laurocerasis has hydrocyanic acid. So this collapse, fainting, sinking. So I'm repeating these three words. Collapse, fainting, and sinking are the key words for this remedy. And that's why you'll understand why it's such probably an important remedy for COVID. And we have seen good results with this. I have used it in a fair number of patients, well over 100, and with very, very good results. And that's why I'm talking about this remedy. The most important thing to remember about laurocerasis is weakness and a lack of reactive power, low vitality. Okay, so we have a lot of remedies in homeopathy and we should learn to differentiate. In fact, as I'm speaking to you, I've kept Clark's dictionary open in front of me. If you have this book with you, do make sure to read laurocerasis from there. Clark tends to combine a lot of important things which many homeopaths don't read because of lack of time, but it's important to go through John Henry Clark's book very, very often. Guernsey gives very interesting leading symptoms, and I think just in 3 lines he crystallizes this remedy. Gasping for breath, patient puts his hand to the heart. Now this one gesture can often be a very, very entry point into laurocerasis. So don't forget this, grasping the chest, okay? As if there is some trouble there. This may result from running a short distance, which puts him completely out of breath. Now, if you see this sudden symptom with people who they put their hand on their chest, something is happening. That may be an entry point into laurocerasis. It may not always be laurocerasis, but an entry point. One could also think of cactus when the clutching sensation comes there, but this is accompanied with dyspnea. So that's a very, very important symptom. A cold tongue and a heaviness of the tongue is a peculiar symptom that has been mentioned in laurocerasis. In fact, there's a case given over there where the person has highlighted this very significantly, the homeopath being E. Wigg, W-I-G-G, where he wrongly prescribed laurocerasis and then he had to antidote it with camphor. Interestingly, camphor is an other collapse remedy. And the beauty is, Clark says very, very clearly that camphor has sudden fainting, whereas laurocerasis has prolonged fainting. Small differences given in Clark, so important to remember. Dr. Cooper has mentioned the importance of laurocerasis, and this is not there in your Borix Materia Medica, for menorrhagia and dysmenorrhea. Very, very fascinating and interesting. In fact, they mention it as a palliative for malignancies of the female genital system. No experience with this, but worth keeping in mind. There is a lot of jerking, a lot of epileptiform symptoms in lorosuresis, twitching of the face. I think very important to keep these in mind. I'm going to be reading this from Clark, and I think it's very important. Those of you who want to make a note of it can do so. Compare camphor for coldness, cramps, and lack of painting. Camphor is sudden, lorosuresis is long-lasting. Okay? Capsicum is an important remedy for lack of reaction. So when we think of lack of reaction, often we only think of opium, we only think of sulfur. But in a wonderful paragraph, Clark has put together something that will be very useful for practice. So for lack of reaction, lorosuresis, very important drug. Opium, lack of reaction in patients where there is no pain. Despair of recovery, chest affections better by lying down. Capsicum, there is lack of reaction in people with lax fibers. Sulfur, there is lack of reaction, hot, perspiring, psoric subjects with chest, liver congestions. Valeriana and ambra have lack of reaction in nervous people. And carboveg has cold knees, cold breath, tongue, and indifference. Lachesis, digitalis, veratrum, and antimony tart all have asphyxia neonatrum. So these are the remedies which mingle with lorosuresis, and that's why it often gets missed, because whenever we think of coughing and we think of the rattling and we think of collapse, we probably go only towards antimony tart, we probably go only towards carboveg. I would say as a homeopath, the learning lesson would be when those remedies don't work, we could point the needle back to this remedy. Having said that, Materia Medica can only be remembered when learnt. So knowing these minor symptoms of this remedy, very, very important. A very important general in lorosuresis is a great coldness and intolerance to cold. Cyanosis of newborns is a well-known symptom, and clubbing of fingers has been reported right from the early days. So this could point us to congenital heart diseases, and I would like Amit later to comment a bit on that, especially with clubbing and the importance of clubbing. All right. There is always a cold sensation. So the word coldness is important, cold sensation in the chest, a rapid and weak pulse, which is probably to do with the cardiac involvement. Dyspnea and oppression of the chest from the slightest of exertion, a very common symptom but important. And a peculiar symptom, which is in italics, is gurgling in the esophagus on drinking. So whenever drinks are forced down the throat, there is a gurgling sound. So you feel the water is audibly rolling down the throat. Now this is a very PQRS symptom, probably when there is absolutely no pathology. Maybe if there is an esophageal pathology, this may not be as important as a PQRS, but nonetheless it becomes a symptom to take into consideration. There is a feeble stream of urine, especially in heart and pulmonary disorders. This symptom brings me to think that lorosuresis obviously affects the cardiac output. So whenever cardiac output is affected, the renal arteries are affected. The renal arteries get affected, the blood flow to the kidney is low, and probably that's the reason for scanty urine. This would be, I think, the most scientific way to study lorosuresis. And I've mentioned about the clutching of the heart, the sunken face, the weakness, and clubbing of the fingers. Most of you who have attended Dr. Habu know that Sir uses this remedy quite as a specific for young females and females who have MVP and who complain of palpitations. Okay, and this remedy has given great results. It helps these patients, and they're often better for years with just a few months, a few doses of lorosuresis with the right constitutional medicine, which in more than often would be probably acid phosphorus or ammonium carb. It's what I remember seeing with Sir, and such patients do really, really well. Amit, you think I've covered it all with the Materia Medica?
I'm sure you have, Sachin. Brian, any experience with Laurocerasus that you'd like to share with us? Brian?
Sorry about that. I meant to be efficient now. I thought it was a brilliant presentation. I don't have much to add. I just see one observation by George Vitulkas, in that an unusual characteristic of the remedy is the tremendous somnolence, sleepiness, often experienced by the patient after the remedy. He says in one case with Laurocerasus, a patient went on to a good recovery from a severe bronchitis after sleeping 20 hours daily for nearly a week. So maybe when they take the remedy, suddenly they're sleeping and they're catching up on sleep. So that I found interesting. I was thinking about the vitality low and what you said about low reactivity to things. I suppose in COVID we do get sometimes very high reactivity, these cytokine storms and overreaction to the virus. But the anxiety, this idea particularly where it says, I'm reading here, the remedy may be used for minor conditions such as a pneumonia which lingers. Yeah, okay, so there are those cases, the long COVID cases, isn't that? A pneumonia which lingers. We know that COVID is closer to pneumonia than it is to flu, for example. May also be used for minor conditions such as pneumonia which lingers, or even when a case of bronchitis or influenza fails to recover properly and the patient is very chilly and weak. So if we see a collapsed state, a chilly and weak person in a collapsed state post-COVID, in the long COVID syndrome, and particularly where there's this anxiety as well, I think that, and all the indications that Sachin has given, that it's certainly a very important remedy. Thank you.
There is a few things I want to add. I slipped my mind. I use the reverse repertory from Radar very often for smaller remedies, and very interestingly, though Laurocerasus is said to be a small remedy, if you take degree 1, 2, 3, and 4, it feeds you back with 3,400 odd symptoms. So that's like crazy. But interestingly, when I do only level 3 and 4 search, there are a few important rubrics which I would just highlight. Probably you could go back and read. One of the interesting ones is head hair bristling. Okay, so this is a very important and peculiar symptom. I think sometimes in young children also you get this when we think of mesarium, head hair bristling. That means the hair gets electrostatic and they can't be combed down. Then you have, interestingly, for a 3-mark remedy, and this is given by Bonninghausen, cancer of the eye. Very, very interesting. Mouth paralysis of the tongue. Very, very interestingly, the gurgling is mentioned, which we have already spoken about. And they talk about throat spasms, esophagus, which is what we spoke about then. In the female genital, pregnancy complaints during Laurocerasus, very important remedy. Kent, Fatak, Allen, everybody's added it in. We have taken the chest, we have taken cyanosis. There are dreams of fire given by Fatak, Bonninghausen. There is a lot of chilliness in the fever states, and typically in generalities, exertion physical aggravates 3 marks, eating before aggravates 3 marks, and small frequent pulse, and a general lack of reaction, which I have discussed in details with differentiation by Clark. So I again urge you to go back to that paragraph in Clark's book and make a note of those minor differences that Clark has put in this small little lecture on Laurocerasus.
Thanks, Sachin. Sachin, wanted to ask you this extraction from Radar that you did. Which version of Radar were you able to do it from? Because I was able to do it from the earlier versions. I don't think Opus allows or has that function anymore. Opus. Because it's a very useful thing. What I suggest, I mean, for those who haven't tried it, what you should try is to extract degree 3 and 4 rubrics and reduce rubric size to around 5 or 10. And you will get some fantastic symptoms for remedies, which will probably be eliminating symptoms for others. So which one did you do it from, Sachin?
Yeah, so this one that hasn't been updated to Opus. I deliberately kept it on the Windows 7 platform, and I haven't upgraded my radar to Opus because Opus has disabled this feature to my best knowledge. I don't know anybody else's experience on this.
See, you should share these kind of tips also.
Listen, guys, I think that you should, Amit and Sachin, and the other Sachin as well. If you look amongst the audience, and if you see some of your pupils and someone who you know is, has some experience and has something to offer, just invite them so they might feel, uncomfortable about putting up their hand. But if you actually invite them onto the stage personally by clicking on their profile picture and saying invite to be a speaker, because I can't do this because I might be talking to someone who's a very early beginner, but you might know if some of the people definitely have something to share. Yeah.
Brian, most of the people in the audience, you might be surprised to know, are perhaps senior to us. There are some of our teachers also in the audience, so it's kind of challenging. But guys, any comments, any questions to Sachin on Lorocerasus, or any of your own experiences using Lorocerasus in COVID or otherwise? Please share. Sachin, you mentioned about the gurgling, the drinks rolling down audibly. Lorocerasus also has spasm of the esophagus, and I suspect maybe it comes from there.
Yes, it is. I think so. And it's a 3-mark remedy for that, and including inflammation in the abdomen as a 3-mark remedy by Kent. So yes, there has to be some thought involved there too.
Right.
So now, Amit, my question to you is, from a clinical medicine point of view, what are the medical conditions that you feel this remedy will cover quite beautifully? And then you take us through your talk on dyspnea, because I don't see anybody who I've been trying to invite being willing to talk quite freely. I don't know. Everybody's looking either scared or shy. Brian would say shy.
Hopefully from our second edition, there's been more participation. But yeah, so when I go through Lorocerasus, the symptom that for me is most striking is from Boric, where he talks about cyanosis and dyspnea, which is worse sitting up. This in clinical medicine is such an unusual phenomenon that when you have a rare symptom in medicine, in life, and you have a remedy for which that symptom is bold and other remedies do not seem to have it, I think there you can almost establish a relationship between the drug, the remedy. So a disclaimer, I tend to use the word remedy, medicine, drug interchangeably to mean the same thing, and no offense to anything. I mean to say remedy, but I do tend to use the word drug. Sorry about that. So I believe most dyspnea you would find is most cardiac dyspnea certainly is worse lying. That is what we call as orthopnea. So dyspnea that is better in sitting is called platypnia. The word platy means flat, and pnea means to breathe. So if you're able to breathe when you're flat, then you're not really able to breathe when you're upright or when you're sitting. And in our repertories, in our Materia Medicas, there are not very, very many remedies that have this symptom. I think it's just maybe 15 remedies with only a few bold ones. I think Lorocerasus, I think Lactasis, Lycopodium. And that's why you will see that these remedies come up with in pneumonia and other lung conditions. So I'd like to maybe, we could talk for a bit about Platypnia orthodeoxia syndrome. This is the exact verbatim medical translation from what Boric says about cyanosis and dyspnea worse sitting up. Platypnia orthodeoxia syndrome. So what it means is that when the patient sits up, one is he complains of breathlessness, and second is he desaturates. So whenever you have this combination, you have to think that there is a shunt situation, which gets triggered for some reason when the patient assumes a sitting and upright posture. Shunt means that there's basically mixing of venous and arterial blood. That shunt may be intracardiac, or it may be extracardiac, commonly pulmonary. So since COVID is a current hot topic, you get this kind of a shunt situation commonly in COVID as well. The reason is that in COVID, there is disproportionate involvement of the lower lobes, where there is better distribution of blood purely because of gravity. So what happens in an upright posture, there is more blood flow to the lower parts of the lung, where there is more disease. And therefore, this blood does not get oxygenated at all. And this creates a shunt. And therefore, these patients will experience this symptom, and therefore, remedies like Lorocerasus and others perhaps will do well. On the other hand, what happens in a lying down position for conditions like this is that there is, you don't get this mismatch. The part of the lung that is aerated is also supplied by blood, so the oxygenation improves. So Platypnia orthodeoxia syndrome and conditions that cause this, of course, it's a rare syndrome, and that's why you can sort of directly connect it with a homeopathic remedy if you come across a patient who has this. Now, which are the patients who have this this phenomenon? One is those who have intracardiac shunts, meaning you basically have a shunt which is normally left to right. So in those situations, there is no problem, because all it will do is that it will cause a hyperdynamic pulmonary circulation, eventually leading to pulmonary hypertension, but it's not going to cause cyanosis. However, when there is a reversal through this shunt, usually you'll find shunts, like the patent foramen ovale or a small ASD which is missed. And then the patient directly presents with this Platypnia orthodeoxia. So what's happening is that when the patient assumes upright posture, for some reason the shunt reverses, usually aided by pulmonary hypertension. And that's why Lorocerasus as a remedy you have to think of even in cases with pulmonary hypertension, because in boric you'll also find dilated veins of the upper limb. Dilated veins of the upper limb are clear signs of right ventricular failure. So you have a shunt situation, you have Platypnia orthodeoxia syndrome, and you have dilated veins of the upper limb. So think of conditions where there is pulmonary hypertension, right ventricular failure, and a shunt situation. So you get this kind of a thing in Eisenmenger's. I mean, sorry for this to the seniors who for whom all these things may be routine. Ashay, my friend, asked me to speak some basic concepts for students and juniors. So my talk will be basically addressed to them. So you get left to right shunts, which then reverse because of pulmonary hypertension, and then these patients develop Platypnia orthodeoxia. So think of Lorocerasus as a possible remedy for conditions that have pulmonary hypertension. And then you have these extracardiac causes, where basically the shunting is in the lungs. So you have an AV malformation in the lungs. These kind of things can get opened up in, say, conditions like cirrhosis. Liver cirrhosis has got a hepatopulmonary syndrome, where there are openings up of these AV malformations in the lung, and the shunt starts when the patient assumes upright posture. So the patient complains of breathlessness and desaturates when this happens, and so think of it. It's a rare situation, but if you get a patient, do think of Lorocerasus in them. And then, like I said, certain pulmonary parenchymal conditions which predominantly affect the lower lobes will cause a VQ mismatch. There will be a mismatch between aeration and blood flow in them, which leads to development of a shunt. So I guess on Platypnia orthodeoxia, this is all that I had to say, and I'm happy to take any questions. Maybe we can discuss some basic symptoms in cardiology later if there's interest. Thanks, Sachin.
Amit, ILD. Amit, what about ILD?
Yeah, so ILD, again, coming back to Sachin talked about clubbing. We used to, in medicine, we are very fond of lists. And I think it's quite important to have basic lists of everything in your mind. I mean, of course, you have books that you can refer to. And as homeopaths, we know that we can't remember the repertory or we can't remember the Materia Medica entirely. We have to go back to our books. But some lists, some basic lists are of use. And we used to have this famous list on clubbing. So 3 by 3 plus 1 was the list. So you have 3 cardiac causes, 3 respiratory causes, 3 abdominal causes, and 1 endocrine. So the 3 cardiac causes used to be, I hope now that I've said there 10, I hope I can recount 10 conditions. So the 3 cardiac ones were congenital cyanotic heart, infective endocarditis, and atrial myxomas. The 3 respiratory conditions were bronchogenic carcinoma, chronic suppurative lung disease, which includes lung abscess, empyema, and bronchiectasis. And the third one was interstitial lung disease. So that also causes clubbing. Then the 3 abdominal causes were inflammatory bowel disease, Crohn's, and primary biliary cirrhosis. And the only endocrine one was thyrotoxicosis. So interstitial lung disease presents with dry cough, shortness of breath, clubbing. On examination, you get fine and coarse crepitations. Usually there is no wheeze, and it's a dry cough. Usually there is no, unless there is superadded acute infection, you will never get expectoration. So in these patients also, there is predominant affection of the lower lobes. You will see that ILD patients are comfortable when they are lying down, which will never be the case with left ventricular failure. I remember my lecturer during our rounds, we were treating a patient of left ventricular failure because of underlying LV dysfunction. And one day I think it was about his 5th or 6th day of admission, we just walked into the ICU and my lecturer just discharged the patient, even without examining him. I said, sir, don't you want to examine? He said, can you see what he's doing? So what the patient was doing is that normally you have a propped up position, right? He had kept his legs on that side of the bed. And he was on the other side reading a newspaper. He's saying that what more evidence do you want that his failure has settled? So left ventricular failures will never be able to sleep supine. They will always sit up. While ILDs will be fine in lying down. And when ILD has this kind of a mismatch in oxygenation, I mean mismatch between aeration and blood flow, they will get platypnea. And when they get it, you can think of loroceratosis and along with whatever other remedies, depending on the other symptoms. Again, I'm not, please don't misunderstand me or misquote me. I'm not trying to say that if this is the pathology, this is the remedy. I'm just saying that, like when I see clubbing, you have to think of 10 things. But you can think of only 10 things. You don't need to think of the other thousands of medical conditions. Similarly, you can certainly narrow down remedies significantly if certain unique symptoms are present. And I think platypnea is one of them. Thanks.
Amit, that has been great because, see, this is what I keep saying. And I think we are very, very lucky to have you to guide us because I'm sure everybody in this room is going to agree that the way you explain this, the simplicity with which you explain this makes it really unique. And I think we all need to improve our clinical understanding, clinical medicine on these lines. And it's going to be great. I hope you continue doing that because I think you are going to take a short talk on dyspnea and it will be interesting because dyspnea is such a common presentation. And if you could condense what Harrison writes in a short snippet for us so we can go back to studying more. And I hope Brian backs me up on that.
100%. I thought that was a brilliant exposition of actually showing how we respect Orthodox medicine and the subtleties of it, and yet we bring something extra to it by differentiating much further between the subtleties of dyspnea. So what Mit is saying is that it's not just dyspnea, there's subtleties in dyspnea, and those subtleties, just like the rest of homeopathic medicine, are what homeopathy is all about, that we respect the individualized response of a patient to an external threat or source or whatever it is. And I like that a lot, to respect the differences in these things, but we don't just respect them, we can actually translate them into practical prescriptions in homeopathic medicine. Thanks, brilliant stuff, Em.
Thanks, Brian. I'm aware that you have some commitments after this, so if and when you feel the need to go, please don't worry about it. So Sachin, maybe I was thinking. So let's see, cardiac symptoms. Typically, a patient with cardiac disease can come with any of these 5, or sometimes they include edema, so 6 symptoms. The first is dyspnea. Second is chest pain. Now, here we don't call it angina because you can have non-anginal chest pain because of cardiac causes, so you just say chest pain. Third is palpitations. Fourth is syncope. Fifth is cough. And sixth is edema. So maybe I'll just talk briefly about dyspnea. And again, I think, it's sometimes some definitions, it's always useful to have them memorized. I don't know, I just find it good to have some things in memory. I mean, you need to have some foundation, some database on which you can build, and then you can do other things much faster. And those things need not really be put down to memory. So dyspnea is basically abnormally uncomfortable awareness of one's own respiration. So it's a symptom. There is no measure for it. Commonly, if a patient presents to you with dyspnea, you have to think of 4 possibilities. One, that this is cardiac. Second, it's pulmonary. Third, it's anemia. So indirectly cardiac because of a high output failure state. And the fourth is that this is psychogenic. So so you ask for the other symptoms, and with the help of which you will be able to differentiate these cardiac cases. Will have, if you have syncope, it along with dyspnea, you have to think more in terms of cardiac pathology. If you have cough with expectoration, you will have to think of respiratory, although you must keep in mind that cardiac conditions can also present with cough. So respiratory dyspnea typically will have a waning and waxing kind of a pattern through the year. So, typically the patients with COPDs and asthmatics will have their exacerbations during their specific periods of aggravation. I mean, in medicine, we were taught that, typically the rainy season and so on. But in homeopathy, we know that, there are some constitutions sensitive to summer and some to winter and so on. But in any case, they will have their own periods. While cardiac dyspnea will usually be gradually worsening because it. So if you have cardiac dyspnea and in terms of a valvular heart, you need to think of mitral valve disease more than aortic valve disease. While if you have angina and syncope, you have to think of more aortic pathologies, aortic valve pathologies than mitral. And maybe we can discuss this in detail some other time. So this is dyspnea. You just have somebody who says that he's short of breath. Then you need to ask him, how short of breath and what is his what is his lifestyle like? For example, for a marathon runner, if he says that he's dyspneic at running 1 kilometer, that's extremely significant. But say you have somebody like me who is dyspneic at 1 kilometer, well, that's been the case for all my life. So you need to find out who the patient is and what is his exercise capacity to be able to decide whether this symptom is significant or not. So there is a classification of dyspnea depending, there are grades, or there's something called as the New York Heart Association classification, which classifies severity of all of the cardiac symptoms. So they have a classification for dyspnea as well. There's a respiratory classification for dyspnea. My friend Ashay and his colleagues and juniors may want to read this up, the NYHA. It's useful. It's none of this information is of no use in homeopathic practice. It's very, very useful. Believe me, it will make a world of difference. So you figure out how much as his exercise capacity, exercise tolerance reduced to kind of judge how bad the dyspnea is. And then you ask about whether the dyspnea is on exertion, on how much of exertion, whether it's on accustomed exertion or less than accustomed, or it is at rest. So if you have a patient who comes, who you see as an acute, and where the patient has acute severe dyspnea, lists are something difficult to get out of my system, but you have 5 main differentials: LVF, acute severe asthma, spontaneous pneumothorax, pulmonary embolism, and foreign body. So in your OPDs, while you may want to refer the patient right away, but preliminary, at least within 2 or 3 minutes, this is what you should be thinking and making the correct referral. So then coming back to more chronic dyspnea, then you have to ask about what position the patient is dyspneic in. Left ventricular failure or heart failure basically will present with orthopnea, that is dyspnea on lying down. This happens because there's an upward shift of the diaphragm and an increase in venous return. And also you can have what is called as PND, paroxysmal nocturnal dyspnea. This is again a hallmark of left ventricular failure. In addition to an increase in venous return and an upward shift of diaphragm, there is a fluid redistribution that happens at night. There is depression of the respiratory center. That during REM sleep, there is increased sympathetic surge, and so tachycardia can decompensate the heart at that time. And also there's something called as a slip pillow phenomenon. So the head goes off the pillow and the patient becomes more flat than the position that he went off to sleep in, and that triggers dyspnea. So patient waking up in the middle of night with dyspnea, think that it is cardiac. And then this, coming to this position, platypnia, very useful, like I said, fewer remedies, rarer medical entity, so much easier to make prescriptions, although you have to make it's difficult to evaluate these patients. If you read up Platypnia orthodoxia, you'll find patients that have had this symptom for a long time without anybody able to put a finger on what it was, and then you just find a small PFO or a small ASD, and you realize, okay, that is what it was. And then you have dyspnea in the lateral position called tripopnea. These are usually due to large tumors in the chest on one side, unilateral large tumors, or unilateral diaphragmatic palsy, and so on. So I think for today, this is all that I'd like to speak on. Sachin, back to you.
That was an amazing lineup of work chalked out for us, Amit. You put that rather simply and nicely. And I think there's a lot of good reading to be done. And I agree with you that lists are important, and this is something that I insist even for Materia Medica. Every drug that comes to mind, there should be an area in your cortex that should light up, at least to know 5 to 6 sharp pointing keynotes of that drug. That's the only way to really quickly improve your practice and readiness to find drugs, because often going back to the repertory loses the essence of Materia Medica very often. Repertory is good for studying, but not great for prescribing quickly. Definitely not for me. And like Amit has given us all these conditions to study, do know that with loroseriosis, try and find the other drugs that have this symptom must sit up better lying down. In fact, in loroseriosis, there are 2 paradoxical modalities. One is ameliorated lying down, like sorinum, and one must sit up. So in which comes, you should be very, very... Make sure to read up Cuprum metallicum, which also has the drinks audibly. Make sure to read up hydrocyanic acid, small remedy, but important, maybe used once in a lifetime by a homeopath. Do at least know its strong keynotes. Definitely read up camphora, which has a lot of similar symptoms to loroseriosis, and the other cleansing remedies that we did. Brian, would you like to say anything, or could we continue?
Yes, yes. I have to go soon because I've got something on the hour here. I'm 5.5 hours behind you here, so it's heading to 2 o'clock. But yes, I would like to add one more thing. That I thought that was fantastic. A fantastic presentation by Amit there, educating us in medicine as well, and why the actual pathogenesis of paroxysmal nocturnal dyspnea. And I'd just like to end on a positive note from my side. and mentioning another remedy which has been mentioned, but I think again it is worthy of further mentioning in relation to cyanosis, to dyspnea, and in relation to loricerasis. I treated a woman recently. I won't go into the case in depth. Had a lot of trauma in her life. She was from Ghana, living in England, a matriarch of a large family with a lot of people who loved her and concerned about her, and she was just about to turn 90. It became clear to me she was in end-stage congestive cardiac failure. So that's also something that's come up, a severe congestive cardiac failure, massive edema in her legs, etc. And, I started off with remedies such as apis, and a constitutional remedy, had absolutely nothing, had any effect. And I'm thinking, all right, she's an old lady, maybe there's nothing that can be done. And then she started developing this horrible rattling cough. And suddenly I thought, this is not anything to do with the chest, this is a cardiac cough. And I prescribed antimonium tartaricum. And the family, they've said the apis didn't reduce the swelling, nothing else has worked, but this worked for the cough. And so I think that remedy also it comes up as a differential diagnosis for loricerasis. So this is the beauty of homeopathy. That cough was distressing to her and to all her family, and now she doesn't cough nearly as much. And when she does, she just takes some antimonium tartaricum. So even in a 90-year-old, you can see something like that. So I found that very gratifying, actually. But anyway, I'd like to congratulate you on this room. I will go now. But I'd like to congratulate you. You've done very well to have 60 people in the room on your first meeting. I know India is a bigger country, but still to get 60 people in your first launching of the club is excellent. I will try to bring people from England to the club to learn about homeopathy. And only thing I would advise you is to open up regularly once a week, but also open up every now and then. There might just be a few homeopaths who can help each other, So if the moderators are available and you feel like opening a room, just open up a room so you have a forum to chat. Anyway, thank you so much for having me here. I will join you again, that's for sure. Thanks.
Thanks a lot, Brian. So any comments, any questions? Dr. Lodha? Dr. Lodha, please share with us some comments or some tips on whatever remedy that you may like.